So as you heard, I'm Sandy Williams, and I'm particularly happy to be here today for two reasons. One, this is my first public appearance after returning to Duke. I've had a long time connection with this university that goes back to 1970, and after a few years of adventuring in San Francisco, my wife Jennifer and I have come home to the Duke family, so we're very happy to be here. I'm also happy to be here today because I almost was not. I was over in Duke Hospital earlier this week, and I ran into a scalpel. Fortunately, it was wielded very skillfully by the great Duke surgeon Ted Pappas, who fixed up a hernia for me. So I'm here against doctor's orders. I wasn't supposed to be out and about so fast, and it's all of you who are physicians, at least, will know the definition of minor surgery is surgery on somebody else.
Right.
So anyway, here we are. We're going to have some fun and some interesting discussion over the next few minutes. I think to frame that up, looking back over 40 to 50 years of medicine that many of us have experienced, I think you could say there have been two megatrends. One megatrend is the continuous and pleasing advancement of medical technologies. The armamentarium of therapies and diagnostics we have to bring to bear on our patients has grown spectacularly from the time that most of us were in medical school. And Duke physicians have become skillful utilizers of that, as well as in this room I know are some pioneers who've developed those advances. So that's very pleasing and exciting, and it goes on and on. On the other hand, there's been another megatrend that many of us find troubling or displeasing, and that has been the increasingly frenetic pace of medical practice forced upon physicians by medical economics, the burgeoning amount of data that physicians have to manage, and information systems that seem more our masters than our slaves, have, I think, taken some of what used to be the spirit of medical practice that we saw and learned about when we were medical students. But I take it as a matter of faith that Duke doctors, wherever you are and others are always doing two things. They are seeking to innovate and drive those advances, but they're also seeking to keep medicine at its core, which is the relationship between a doctor and a patient. And we're going to hear today from two eminent alumni who have spent their lives struggling with these issues. So I'm going to ask each of them to first just give a brief introduction to reflect on the topic that we've chosen today. How do you keep a caring culture within the medical arena where you work, and how do you keep the patient at the center? Jeb, let's start with you.
Thanks, Andy. First of all, I was discussing some of these questions with my wife this morning, so she gave me most of these answers. I just jotted down a few things to keep this concise. First of all, I just want to comment on creating a caring culture, whether it's in your office or whether it's in a bigger institution. There's no doubt that culture is modeled from the top of leadership. But in the end, it is actually carried out at the bottom of the organization by the men and women who are nurses, the house cleaners, the people who are in nutrition. And so I think if the leaders don't round and connect with these people on a regular basis and tell them you really appreciate the way they care for patients, you're missing a really important opportunity if you're in leadership. I think the mission statement of every office, every institution needs to have some comment on compassion or caring. The Roper St. Francis system that I'm in, the mission statement is healing all people with compassion, faith, and excellence. So I think if your mission statement says that, it's likely to happen. A couple comments on patient-centered part of this. Well, the needs of the patient come first. We've heard that, and I lived in an institution at the Mayo Clinic for 20-some years where that was the motto, and it's the motto here. But when you think about that, sometimes we forget that the caregivers are also patients. And I think we need to pay a lot of attention to the people who work around us, because we hear about burnout. We'll talk more about burnout. So I think as we think about a caring environment, we need to think about the patient and the people giving care. There were three concepts that I left Duke with and came from different physicians. Certainly Dr. Stead always said what this patient needs is a doctor, and I think he meant someone who was not only knowledgeable but cared. And Hans Lohenbach, who was a psychiatrist and I rotated with, whenever we went into a room, he always said, I am here to help you today. And I've taught my office staff, no whether the receptionist or the nurse, to say to the patient, I'm Jeb, I'm here to help you today, not why are you here? And then finally, never take hope away from patients. I think part of this caring is I will be here to take care of you. I may not have an operation, I may not have a drug, but I will be here to take care of you. So those are my brief comments.
Kurt? Well, thank you, Sandy and Jeb. You kind of see this cast. I'll get it out of the way up front. I ran into a scalpel too. But before that, I fell off a bicycle, so had to have some surgery, and it's going great. But I think back just some to add to maybe a little bit around my introduction, which was probably about somebody else, I think. But to tie it back to Duke, what I learned at Duke was there was a culture of patient-centeredness, and I saw the mentors that I had and the teachers and all my great classmates that are here. What we experienced has stayed with me about that connection with the patients, and using the best technology and things, but always around the patients that we were caring for, and there was this real personal connection. Duke was small enough that it felt like you were part of a family. And I've always wanted to, wherever I was, and I've been at Children's National now most of my career, but I've always wanted to re-emphasize and put that at the top, that we're part of a family, we're all important. There's this creating a culture of mutual respect and collaboration. The second experience I had at Duke that really concentrated me on this was while I was at Duke. Duke saved my life as a patient. So I discovered a papillary cancer in my thyroid while I was working in Dr. Lefkowitz's lab with Sandy, and had to have surgery myself here at Duke. And it's a little weird to be rolled in a wheelchair on a gurney with your gown flapping open and back, and your classmates running by and saying, "Hey, buddy, how you doing?" Having the nurse that's putting you to sleep be the girlfriend of one of your friends, and I'm worried about, well, what is she going to see when she... But it taught me, and then post-op, I was put on the cancer floor, but I was the youngest guy, and so to see things through the perspective of being a patient, that never left me. Seeing it through that lens, and so I think that joint perspective of what I learned about a team and a culture and a family is a way to work together, and then keeping what the patient is feeling like and what that experience is like at the center of things really started here at Duke.
Yeah. I might add, as a personal note, with Kurt beside me here, that when my newborn granddaughter needed an operation, you know who I called. It was Dr. Newman, and he took care of the problem. I'll also tell a story around this theme that goes back to my first rotation on the medical service. The medical team was making rounds with the attending physician, who was Bruce Dixon. Anybody remember Bruce Dixon? Yeah. Great teacher. And the intern, I was just a second-year student, but the intern was presenting a patient who came from a lower stratum of society, economically and educationally. And the intern was referring to the gentleman in a somewhat disrespectful way, calling him by his first name and somewhat overly familiar, it seemed to me. And I saw Dr. Dixon stiffen when we were in the room. And he didn't say anything else, finished the presentation. He greeted the patient warmly and examined the patient. And then we walked out in the hall. And as soon as he closed the door, he grabbed this intern by his collar and shoved him up against the wall and said, "Son, any patient who crosses the threshold of Duke Hospital would be treated as if he or she were the king or queen of England. And if you can't treat patients that way, you have no place here." Wow. That got my attention. and I tried to deliver a similar message throughout my teaching career. Anyway, let's go back to Jeb now. You have had and have now leadership roles in great medical centers. In your viewpoint, what is the most important thing, the most essential element that a health system needs to have to support physicians and patients in the caring culture?
I think we need to remember that healthcare is really about relationships, not only relationships between the physician and the patient, but amongst the caregivers. And we talk about technologies, so much about how there's been advancement in technologies. But with all the advancement in technologies and the faster pace, I think we sometimes forget that the most important thing in our daily life in a healthcare setting has to be our relationships. I had a CEO of Roper Hospital, Matt Severance, who taught me this concept of daily rounding. I noticed that Matt would walk through the entire hospital in the mornings, and he would stop and talk to Kathy, who was cleaning the rooms, and he would talk to the head nurse, and he would come by and ask me, and what he would ask me is, "How you doing? Family okay? What do you need today that I can do so that you can give the patient the best care?" So I think any system that doesn't keep these relationships in mind, that does not have a system where the leaders at the top are rounding and talking with patients and with employees, is not going to be the kind of system that we want. You can have beautiful hospital rooms, you can have beautiful operating rooms, you can have the latest technologies, but if you don't have the best relationships among the people caring for one another, I think you're going to lose a lot.
Well said. So Kurt, you've been the leader of a major health system that's continuously evolving. And what do you do to make the heart of the hospital beat with these values in the face of the inexorable financial and other pressures that come at you?
Well, being a CEO of a hospital was not necessarily in my career path. Just as a sidelight, there's a great program here now at Duke. I'd like to make a shout out. Dean Taylor is here, Colonel Taylor, where they're putting leadership as an intentional course to help a lot of leaders come from Duke. But I was kind of an accidental leader in a way. I was happy doing surgery. I was a chief of surgery, and so being a CEO of a hospital was not anything I'd really thought about. So I'm glad there's now a curriculum and there's a focus on leadership in the medical school to help medical leaders. So what I would tell people, and we're an independent, standalone children's hospital, and we, with children's health, the financial pressures are just intense. Over half of our kids are on Medicaid, and we're just trying to do everything we can to be sure that children have the resources that they need to be healthy and we can care for them. So it's an intense financial thing, and so as I was looking at the position of being CEO, I got a lot of questions. Well, how are you going to balance all this? What's your plan? What's the strategy? I didn't have an MBA or anything. And I just, my thought was, well, if we keep the patients, families, the kids at the center of what we do and do that well and do it right and do it better than anybody else, the finances will follow. And I said that over and over enough that I think the board decided, well, we'll give it a shot. I'm not sure anybody really believed me, and I'm not even sure I believe myself, but I just had this thought that is what people want to come to a place. They want to come to doctors. They want to come to nurses where they know and they can feel, and it's just the whole heart of the hospital, as you put it, Sandy, that's where they're going to get taken care of well. And so I was given given the position, and our finances were tough at that point. But through quality, safety, best outcomes, the kinds of approaches that Jeb was talking about in the hospital, creating that culture with a doctor at the top of the hospital. And I went out and recruited a nurse to be the chief operating officer. My idea was that the business objectives of the hospital should be serving the patients, the doctors, and the nurses. And what I'd seen all too often was that it was opposite. The doctors, nurses, the clinical care were serving the business objectives of that hospital or that system. I wanted to turn that on its head, and I thought the best way to do that was to have this symbolic, and more than symbolic, the doctor and nurse at the top. So we built our teams, we built our approach, and built our culture. And what happened? The finances did follow. 2 credit upgrades, reserves deepened, and what I saw too was beyond the finances, we were attracting better talent. People wanted to come to a place like that. The philanthropy picked up. People want to donate. Donors want to be engaged with a hospital where they feel that connection. And the engagement of the employees, like you're talking about, picked up. People want to make an impact with their work. They want to be part of an organization that's making an impact, that they can feel that. And so through those examples, I think it is at the heart of what we do. It's that care, and that's the right word, the care of the patient, the healing of the patient. You want to use that language. It's not about the business. You got to be smart about the business, but it's really that care and that healing and building that culture, and then the results will follow.
That's well said.
Yeah, I see that same principle at work in the biotech companies I work with. The successful companies are those where people are there for the mission of developing something new that's going to help patients. If they're there to collect their stock options, the outcomes are not going to be anywhere near as good. So I think that's a very important principle. Let's change direction a little bit, Jeb, and talk about ourselves as physicians. It's hard to do your best job caring for a patient if your own life is in disarray. And you've thought and written and acted a lot about physician wellness. Want to tell us a bit about your thinking there?
Yes. But first of all, I'll disclose, I think I probably burned out several times in my long career. And I think the resilience you need in a career goes up and down depending upon the stresses in that career. Early on, I think the stresses to our wellness are being students and residents in those hours. And then somewhere in mid-career, it may have to do with family, and then in later career with health. I think self-awareness is probably the biggest problem for any of us. Are you really aware of your thresholds for your health? And more importantly, are you aware of the people around you? I mean, we're all driven, and we had people around us who supported that. I would say sometimes I wasn't aware that I was doing okay, but the people around me working for me were not. So I think self-awareness is about them too. Just a couple comments on the basics. The burden of medicine, certainly the burden of surgery, is call. And we heard yesterday from Dr. Sexton about just the importance of getting rest. I was talking to Alice. She's a medical student. She has a degree from UNC in nutrition. Our nutritional lifestyle, how do we take care of that? When I hear people saying, well, I couldn't eat all day, that's not a good thing. Exercise. I remember when I was a student that Dr. Lowenbach would say, we have to walk everywhere. Walk. And you don't have to go and be a high-performance athlete, but I think you have to take care of yourself. And finally, I'm getting back to relationships. You have to have friends and people that you can have fun with. You really do. And I always try every day to think of three things. I'm going to help someone. You're a doctor, that's easy. I'm going to say a kind word to someone who's not expecting it. And that really, really helps. And I'm going to find someone to give me a belly laugh. And I have a stepbrother who usually sends that to me in the mail. And my final comment is that under all of this stress on us, we really have to pay attention to our intake, whether it's alcohol, medications, or other things. I've certainly seen some wonderful, wonderful physicians and surgeons end up their careers in a way they did not want to because of alcoholism. So I think we really need to pay attention to all these things.
Now, I remember as a fourth-year medical student, I had the incredible privilege to do a tutorial with Dr. Stead. He was several years retired as chair of medicine by that time, but he and I would go somewhere in the hospital and review patients together. And I did this for a couple hours every week, and just the two of us. And that was, a precious experience. But what I remember is we never used an elevator. Dr. Stead never used an elevator, always on the stairs. We are privileged to have some current medical students with us. I see 3 at least. Are there others? Raise your hand so we can thank you for being here. Oh, I see more. Oh, great. My great friend and mentor, Andy Wallace, who was chief of cardiology and later head of Duke Hospital, used to point out frequently that the only reason that Duke Medical School exists that's unique is the teaching of medical students. Other kinds of institutions do research, other kinds of institutions can deliver clinical care, but our raison d'etre is the education of students and other health professionals, and so we never want to forget that. So Kurt, I'm going to point a question at you now and ask you to turn back the clock to your days as a learner. What were some of the challenges you faced then, and what would you say to those that are just starting on this path?
Well, I'm going to have to be honest here because it's a reunion year and a lot of my classmates are here. And one of the first things I learned when I arrived at Duke was how to bridge conflict. I'd been at UNC and now I was at Duke, so how was it? But, it's one of the issues then, and maybe even more acute now, was just the explosion of knowledge. I was overwhelmed by, and to some degree, not to say anything negative, but it was an awareness that the Duke curriculum really is front-loaded with trying to learn a lot in a very short period of time. Particularly at that time, it was science. I think probably now there's more of an integration of things, but trying to handle just the quantity of knowledge and how to deal with that. And I think that was one of the great things I learned at Duke was how to manage that, and that it was okay not to know everything right up front, but to know how to find answers. Yeah. And that served me well. I think the other thing was to learn to rely on mentors, and that is not a given. And it's frequently when you're in situations where you're uncertain and you're hesitating to reach out. What I found at Duke was such and maybe it is this sense of being a smaller or maybe a little bit of an underdog, or I don't know what it was, but there was always this sense of reaching out and giving somebody a hand. And, hearing about Dr. Saveston and remembering how he reached out to me and launched me on my surgery career, working with Dr. Lefkowitz in the laboratory with you and Rusty Williams, and these Nobel-winning science. It was never that way of hierarchy. It was, there was this sense of, boy, if you need an answer to something and you're on a project, you just go over there and knock on the door and build a team and collaborate. So that's a long-winded way of saying is that it's. I think it's probably even harder now as things get bigger, things get more corporate, more business-like, to stay for those of us that are leadership positions, and then those of people in the learners, but to continue to build those relationships like Jeb talked about, that personal, and then also the humility, the humbleness. It's okay not to have to know everything, and because it's in some ways easier to access knowledge, but it's easy to get overwhelmed, and I think that's what I worry about. Are things getting too big, and how do we keep things personal?
I just want to add one comment about the importance of teachers and leaders and senior people acknowledging what young people are doing. I remember when I was an intern, I had my first paper published that I had done here, and I got a handwritten note from David Sabison saying, "I saw your paper, congratulations." Can you imagine what that meant to an intern in surgery who was dragging his tailpipe around and having a hard time? And Don Hackle, who in pathology worked with me, he was in San Antonio one time when I was in the service, and just out of the blue, he called me up and said, "Jeb, I haven't talked to you in a while. How are you doing?" And that kind of connection, those long-term connections and encouragement mean so much to all of us as we go through this long career.
Yeah, Nick and I were talking at lunch. I received handwritten notes from Dave Sabiston years after I had left medical school. When something good would happen to me, he'd write to me. That's a special touch.
One great thing about Duke, and I think all of us probably experienced this here, is that you were encouraged to take chances. And that's what that third year was about in a lot of ways, was, hey, it's okay to, do something. And, I worked in a lab. I didn't end up being a researcher, but boy, did I develop an appreciation for research, that how important it was to an organization that really came back into play when I had a chance to be a leader, that it was an important value. So, the other thing I come back to, though, is that I'm so thrilled, and this is, again, a sense of how Duke is a leader, is to have this institute or academy around leadership. There's nothing like that to help physicians, nurses, whoever, medical students, embrace the qualities and be intentional to incorporate that through our careers. Because we kind of learned this stuff on the job. We saw people that we wanted to emulate or gave us some ideas. But it's just wonderful that Duke is moving in that direction. It just fits with, everything that goes on.
Well, I think the three of us could do this for the rest of the afternoon, but the rest of you may have other better things to do. So I think it's time to move on. Thank you, Jeb. Thank you, Kurt. Thank you, audience.